The U.S. military is now taking a hard look at how to treat veterans with severe brain injuries. Some of the most groundbreaking research is happening right in this local area in Dallas. Now, the number of Americans with traumatic brain injuries went up dramatically during the wars in Iraq and Afghanistan. It actually peaked in 2011 and has been declining slowly, but last year alone we still had more than 27,000 new cases. Many of the worst cases are combat related, like the case of one former Navy SEAL who shared his story with Fox 4 News. And James Rose joins us with the story of Mike Day and his mission to help. James.
Well, Steve, this is a story of a wounded warrior and a Dallas doctor, and it's hard to say what's more incredible: the survival of this Navy SEAL, or the unorthodox therapy that could become the future treatment for people suffering from PTSD and traumatic brain injuries. Retired Navy SEAL Senior Chief Mike Day suffers from what's called the invisible wounds of war, but his body is riddled with very visible scars from a 2007 battle with al-Qaeda operatives.
I got into a gunfight with these four guys. I was shot 27 times. I got shot in both legs, both arms, my abdomen, my buttocks, my scrotum, my left thumb, and my right scapula was shattered in about 30 pieces.
A grenade blast knocked him unconscious in the house where the fight was raging.
I look back on that and just completely amazes me that I walked out of that house, which I did. I walked out of the house. I walked to the helicopter.
But the damage to his brain was already done, the symptoms persisting for 7 years.
About a year-and-a-half period, I slept about an hour a night. And I actually thought I was going mentally insane because of the sleep deprivation.
Day heard positive things about the Carrick Brain Center in Dallas, and in just his second week of treatment,
I'm sleeping about 5 hours a night. The sleep's a lot less broken. Instead of waking up 15, 20, 25 times a night, might wake up once or twice a night.
If you're not sleeping, your brain is not healing.
Dr. Kagan Randall says one of the tools in his treatment box looks like a ride you'd see at the state fair called the OVARD.
And that chair moves in sequence and pattern all to the patient's deficiency. So we can stimulate their brain specific to the patient's needs.
Randall says all the symptoms of traumatic brain injury and PTSD go back to a very specific area of the brain, and directing therapy there allows the brain to heal itself without operations or drugs. One of the key symptoms doctors see is a lack of balance.
If we can determine the unstabilization of the eye, then what we can do is attach a therapy to it that will stabilize the eye so that as I move my head in any plane, I can still maintain eye fixation on you, which is incredibly important in your day-to-day life.
Now both men are dedicated to helping other veterans.
Well, my job before used to be finding bad guys and doing terrible things to them. I was pretty good at it. My new life's mission is to find people that need help and help as many people as I can.
Is fulfilling in a way that I've never experienced in my life. And so it has redefined purpose in me, and my life's mission is to help as many veterans as possible.
Now, Mike Day says aside from improved sleep, his blood pressure has also gone down, and he's so impressed with the therapy, he's participating in a triathlon to raise money so other veterans can have the same experience. Dr. Randall says so far, private donations and small investments by veteran organizations are helping pay for the clinical trials. He's hoping to have enough clinical data soon to see his approach go mainstream. Steve?
All right, Mike Day's amazing, James. Thanks for introducing us.